With so much talk about nutrition, it seems that people are health conscious and they're paying attention to eating healthy. But nutritional studies show that few U.S. adults get the recommended dietary allowances of nutrients, and those with disabilities have even worse nutrition than the average person. So, what's going on? I mean, we certainly don't look under or malnourished, and it appears that we're getting the calories but not the nutrition that we need to keep our bodies healthy.
There's been a big change in what's available for nutrition over the past 50 or 75 years. Now that we process food because we move from the country to the city and have to feed more people in the city, and finding fresh food is not the easiest thing in the world, we wound up doing a lot of packaged food, and a lot of it's not food at all. It's in a cellophane wrapper. It's got an ingredients list. It doesn't look like food.
Well, we like to joke that a lot of times the box is probably healthier than the ingredients
are.
Well,
at least sometimes it's safer than what's in there. That's right. So when we're talking about nutrition, we have studies that have been done by the government or the USDA on at least 3 or 4 times over the past 40 years. And they show that hardly anybody in America now is getting adequate nutrition, and they're basing this just on the RDAs. They're not basing it on what our nutritional needs are if we're sick, because they're even higher in that setting.
And we have an epidemic of chronic disease.
For sure. And if you don't put into your body those nutrients that you need to make what the body needs for strong defenses, to make cell membranes and hormones and enzymes and all the things that we need, they simply don't get made. And if they don't get made, you simply can't work in an ideal way.
Well, the other thing, too, is that if a person is disabled, say, for example, sometimes they have a reason why they are, because it's difficult for them to go to the grocery store and to get the healthy foods and maybe even to prepare them, and maybe they might even have problems swallowing or
may not be able to afford it either, because a lot of people who are in condition like that can't make a living, and they depend on the welfare that's offered, and it's usually not that much.
But back to normal adults that don't have any disability, I really think that people need to start learning about healthy diets and nutrition when they're in school. Really, I think they need to learn it when they're in preschool.
Oh, for sure.
And kindergarten. Children at that age are very, very open to learning things like that. I remember years ago when I was reading to our granddaughter's class when she was in about the 2nd grade, and I was reading her The Adventures of Mickey Micro.
Yeah.
And what ended up happening was that the teacher said, ever since you've been reading this book to them, the kids are lined up at lunchtime to wash their hands. And I thought, well, that just shows how open the kids are to learning things like that.
For sure.
You and I even went to the school to give a talk on nutrition, and I was surprised, really, at how many children attended, because it was during their lunch period.
Yeah, and then we watched what they were eating.
Yeah, lots of starches.
Yeah, a lot of sugars. So we need to pay attention to nutrition, because we're not getting what we need. And about half of America has a chronic disease. We should be doing everything we can to support the journey back to wholeness and wellness, and a lot of that comes from food.
And again, we've said this so many times, but doctors really need to have more education on nutrition when they're in medical school.
Oh, for sure. I got about 1 hour of nutrition at Duke when I went to medical school there. And from what I've gathered, most medical schools don't have much more than about an hour now either. It's an interesting way the economy works in medicine. Those organizations that have something to gain by training doctors in certain ways take advantage of it, particularly the pharmaceutical industry. And what they do is they convince doctors that their products, their drugs, surgeries, and technologies are the best way to go. But they don't talk much about nutrition. And as a consequence, a lot of oncologists don't pay any attention to what their cancer patients are consuming. It's like, why would they ignore something like that? And the only thing you can do is say, well, unfortunately, they weren't trained, they didn't learn on their own, and they're ignorant.
Well, there are a few things that I've noticed that doctors are paying some attention to that have to do with supplements, like probiotics, for example.
Yes.
They're finally starting to use those, and fish oil, except for they're still giving the patients aspirin. And vitamin D, because it's known that we've got pretty much of an epidemic of a shortage of vitamin D.
Yeah, well, our food doesn't have the nutrients that we'd like to think. Our soils are use nutrients up. You can't keep planting the same things in the same soil and expect that it's going to have the same nutrition 10 years later. Because if you use up all those minerals and other substances that are in there that you need, they're not going to be there. And then if you package your food, you process it, refine it, take, in the instance of white bread, you take about 25 things out, put 3 or 4 back in, and call it enriched. It's like, who are you trying to kid?
And then if you see what people eat in the hospital and what they serve them,
Still, most hospitals.
always the white bread, too.
Well, that and a lot of carbohydrates. And even the doctors who don't know that much about nutrition are eating things that are not healthy for you. When I went through the doctor's lounge the last time a couple of years ago and looked at what was in there, it was like, it's amazing doctors aren't sicker than they are. So when we're looking at this whole business of nutrition, we have to spend more time taking care to find food that's fresh and whole and unprocessed and not refined, that hasn't been sprayed with toxins that will affect our detoxification capacity and poison us and put us at risk for chronic diseases like cancer. Until we do that, we're going to have a problem staying healthy. And at the moment, we're probably the first generation, those people born today, that will not live as long as the generation before them. So lifestyle is what we need to pay a lot of attention with, and it starts with good diet.